Hi, my name's Ash. I'm an esophageal cancer researcher and surgeon. This video is being made for patients as well as their friends and family for those who receive feeding tubes. The purpose of this video is to help support patients and their family and friends in managing a feeding tube after it's been inserted, which is often an overwhelming experience. The video will involve a surgeon talking to you about the purpose of the tube and how it's placed, as well as a dietitian talking to you about how to use the tube and the components of the tube itself.
Many patients with esophageal cancer have problems with swallowing, and this may lead to weight loss and the risk of malnutrition.
So from a dietitian's perspective, the Jej tubes are really essential part of helping you recover from your surgery, and they're really important part of you maintaining weight that you may then find hard to get back. Any weight that you lose during your treatment and post-surgery is really hard to regain, particularly the muscle mass. So using your Jej tube and really working hard to maintain your weight is really important. The Jej will help you achieve that.
Feeding jejunostomy tube, often been referred as a Jej tube, is when a tube has been inserted from outside the body into the bowel to allow us to give patient nutrition. This tube often stays in for 6 to 8 weeks following the major surgery such as esophagectomy.
Once you come out of surgery, before you're going home, the dietitian and the nurses will be there to help take care of how to teach you how to do the feeding. When you perform your feed, you'll need the following: a syringe, the pump, a pole, your formula, and your spike set. Once you have that set up, then you need to get your formula up and get that organised, ready to go. With your formula, once that's hanging on your pole, you'll have a spike set that will attach from the formula to the machine, your pump machine. And then the other end of that spike set will attach to the Jej tube on your abdomen. Feeds are given daily, usually at night time, and the reason we do it at night time is so that you can have freedom during the day and not be attached to your pump and your pole. So a feeding can take generally between 10 to 12 hours because we know that most people want to get about 8 hours sleep, so we tailor our rates and the amount to fit through a 10 to 12 hour period. There's a lot of flexibility that we tailor the feeding and the rate we do and how we do it so that it interferes as least as possible with you in the evening. In terms of the types of feeds, your dietitian will work to get what's most appropriate for you, but there are a couple of different options. We have formulas with fibre, which can help with people's gut function. We also have more concentrated feeds that if you're losing weight or you have particularly high requirements, then you can be put on a more concentrated feed so that you get more calories in less volume. It can seem really overwhelming to be told that you have to have a Jej tube, but a lot of the problems that you'll experience with this, there are solutions for, and with really good communication with your team, we can help you with this. So please communicate well and just remember we're here to help.
In preparation for what comes after the procedure, we would recommend watching this second video regarding home care. This involves candid recounts and experiences from previous patients and carers regarding living with their feeding tube, as well as tips and troubleshooting information from us to help you with your journey.